It's just us. Yay. Oh, look. I knew it. I know Stacy's coming too. How are you, Katrina?
Huh?
I said, how are you?
I'm doing good. I'm tired.
Yeah, it's been a weekend, right? Lots of studying.
Yeah.
Assignment.
Uh-huh.
A
We
double.
have like 5 workbook chapters due for peds this morning.
No.
So yeah.
Girl?
So
Oh,
yeah. So I was working on that all weekend and it took forever.
oh my God. And those workbooks are quite, I always test out everything before I assign it. Wow. They're quite time consuming.
Yeah.
Yeah, it takes a lot of time. And then to have to upload it and everything is not always the funnest.
Uh-huh.
Well, I'm glad it's Monday. I know that sounds weird, but I think it's going to be a better week.
Yeah, I feel it too. I think it's gonna be a good week.
Yeah, me too.
Just have to channel the vibes and then
Exactly.
it'll just come to you.
Exactly. They say if you smile, even if you're not happy, the studies show that it actually will it'll almost trick your brain into thinking you're happier than you are. So
I believe it.
So I think everyone should just smile. Everyone. And look at everyone joining us. Good morning, everyone.
Morning. Morning.
Happy Monday. I'm just giving everyone a couple of minutes. And I am recording this. I think I just saw Stacy, her name. I get confused because Anastasia. Maybe I didn't. I always see Katrina's name and I think it's Stacy and it's not. I don't know why. I like link the two together. Okay, so this is being recorded just so you guys know, and I'll tell you why in just a few minutes. I'll wait until about 8:05, and since it's being recorded, everybody would have the option to see it. But I had an epiphany last night after a really good conversation with a student that made so much sense. I think I was so far in what I was doing that I wasn't realizing that I was wasting so much time when I could do something so much different. So I think it'll be good. Oh, someone's chatting. I forgot. Let me turn that on. Good morning. Oh, good morning. I love that. All right. Beautiful, beautiful, beautiful. Okay. So we're just waiting about till 8:05. So everyone get your tea or coffee or whatever. I chose 2 tea bags this morning. Tranquility and ginger. Figure might as well double do it, right? Ooh. Winter is upon us, or what is it? Fall's next. I kind of slightly love the rule of like the mute, but I partially hate it because then I feel like you're kind of talking to yourself. All right, one more minute. Thank you guys for waking up on this early Monday morning. For a second, I thought it was just going to be me. It was just Katrina and I. All right. Amy. Oh, there's Amy. You're the second one to sign on. Good morning. Ben. Oh, yay. Okay, cool. So we have only one guy's on here?
Oh, really?
You're holding it down, man. Thank you for coming. So I'm going to start because I am recording it and people will see this. So as I mentioned just a few minutes ago, I kind of had an epiphany last night. I was talking with one of the students in your class and in your cohort, and she made a really, oh, now you're not the only guy. Louise showed up. So she mentioned something that made a lot of sense. So we made our new kind of how we were going to do things as of last week, which we will do this week because it makes sense, I think, for where we are at. And then she mentioned how Miss Carol does it, which makes sense. And I love, and I mean this to all of you, if anybody ever has any suggestions or like, oh, you know what, I saw this really work. And I mean, I'm new to Zoom as far as this type of lecturing. So I feel like at least for the last lecture I made on burns, I feel like I finally am settling in, and I'm kind of, you know, but it takes a couple times to really get it. But she made a comment of, you know, why not just do Monday, do the lecture on Monday, record it on Monday, and just record that, rather than spend 6 hours preparing for the lecture, doing the lecture, downloading it to Zoom, and then downloading it to YouTube. And it's like, why couldn't I even see that? I think, again, because I was so in my own head. So I think that makes a lot more sense, because we're here together. You can ask the questions in the moment. A lot of you may not have time to watch both videos, and it's all in one place. So I think that's a fabulous idea. And also it helps me too. I mean, as you guys were all overwhelmed, and I think my brain would be a little bit more efficient as well. So not today. We're going to continue with what we had already planned, because I already prepped it and planned it. And I think we're going to just do it from here on out Monday morning, and it will be recorded. So if you can't come, you'll still get the lecture. You'll still hear the questions. And I am still going to do like the NCLEX questions and kind of those fun things, add different things in, so it's not stagnant. So does that sound, and if anyone has any comments or suggestions, please, again, I always say it's a safe place. It is. So please let me know if you have any suggestions or if that sounds good, because it's kind of the same thing. Instead of having 2 videos, it's just one. Okay. All right. So let's go ahead and just get started. I know that you've all had a really rough week. So and burns is not the easiest topic. So hopefully everyone that I've graded, I think there's only 6 that I haven't graded for the quizzes. You guys did really, really well. And I do know that the burn is 54%. I was trying to throw you off, which probably wasn't the best question to throw you off, but only 2 people got it wrong. So I was kind of like, if they didn't pick 90%, I did give you some credit, just in case I haven't graded you yet. If you picked 40% or the other one, that 52%, I gave you some credit. So housekeeping is, I don't know if you guys saw, probably you're all avoiding my Canvas right now. So originally I thought we were just doing hemo. So hemolytics, 3 chapters, 3 weeks. And even though the whole time it had said the immune system as well, that's 2 chapters. So we have 5 chapters in 3 weeks, which I believe is a little bit overwhelming. So I wanted to let you know that I'm going to do my best to, which even makes more sense on why we're doing what we're doing now on Mondays, because we'll all be here together. We'll have a full lecture. I'll be lecturing with a PowerPoint or whatnot, ask some questions. You guys can ask questions. I was even thinking about potentially opening up a discussion board. The only reason I was afraid to do that is what if I don't have time to check it and then I forget, and then I don't want you to feel ignored. So as of this point, I'm kind of going back and forth. We'll see how it goes. Let me know as we continue on. But I hope you please don't try not to get too overwhelmed when you see. You probably already got all the emails. Amanda posted something like there were like 25 of them yesterday. Even I was overwhelmed when I saw them. So I will do my best, and I will upload the first couple assignments today so that you can get started if you'd like. Your test, I believe it's open till, is it Wednesday at midnight? I opened it up because you guys have so many different clinical times. I just was like, you know what? You have 75 minutes to do it. You're going to be doing it anyway. It's not proctored. Just take it when you can take it. There's 37 questions. It's worth 50 points because there are quite a few, like 5 short answer questions, which, as you've noticed, they're pretty reasonable questions. I don't think there are too, write 8 sentences on this or that or whatnot. So that's just the housekeeping for this morning. Are there any questions about what's coming up or what's due, or you pretty much done every assignment that you need to do except if you haven't done your test yet for integumentary? And I will wrap up integumentary. Today is my plan, so that everything will be graded and we can kind of, except for obviously if you haven't taken your test, and we can kind of move forward. I try to get your grades as quickly as possible. Okay. Any questions or concerns about anything having to do with anything that has been done so far? And again, this is being recorded, so I will put it on. So if you're signing on right now, you will see everything we already talked about and our kind of new change that we're going to do. Okay. All right. So today we're gonna do our new way, and then next week is another new way. So I wanted to start off just by again telling you the expectations and what we're gonna do today. Of course, we're here for questions. I have some. I prepared 3 questions that I'm gonna ask. 1, 2, 3. Maybe I'm lying. 4 questions that I'm going to ask you guys, and hopefully you will volunteer to answer. Otherwise I'll have to be mean and like call on you. And if you don't know, just say pass. It's fine. And then we'll pick on someone, and then I will pick on someone else. And then I have a 5-minute video on kind of the psychosocial part of, I didn't want to make it too much a part of it, but I do think that's an important aspect of burns, is the psychosocial and the, just being out there in the world. And a lot of the times if it's a severe or even partially severe burn, you can't hide that, and the recovery process. So I found a video that kind of did both. I thought it was kind of interesting. It's only 5 minutes, just quick, just to kind of make sure we hit all our bases. And then the fluid loss, for whatever reason, in my opinion, I this is just me, maybe not you, but I think that's one of the hardest parts to explain. And, the permeability of the capillaries and this and that. So I found a 10-minute part of a video. You all know her. It's the one with the Southern accent. Some of you love her. Some of you, her voice gets on your nerves, but she explains it very well. So I do want to show that to you, so to make sure that you really, really get that, because I don't feel I explained it very well. And I want to make sure that it is explained well. And I am not afraid to say what I'm good at and what I'm not, and I don't feel I did that very well in my video. Okay, then I have the and then I have 3 NCLEX questions. And the way I'm going to do the NCLEX questions, and I'm doing this on purpose, this is how Hartnell does it. Hartnell College, they don't type them out like I do. So usually on 3rd semester, I try not to type them out. I actually verbalize it. So that it's almost a little bit harder to answer, because you have to actually kind of think about it rather than getting to relook at it. So I'll read the question and then the answers, and then whoever answers the question, I want you to point out what you think is important in the question and what we're looking at, and go from there. Okay? And then we'll answer any questions that anybody has. And if you haven't watched my video, I'm not saying it's like the best video that ever happened, but it's definitely the best one I've made so far on burns, I think. So if you haven't taken your test yet, I would watch the video. That's just me. Okay. So let's go ahead and start. So my first question, I'm just gonna, well, first of all, do any of you have any just not burn questions, but general questions about anything before we start? You're like zombies. This has been such a week. You poor people. I'm so sorry. Okay. All right, so let's go ahead and ask the first question. So, and anybody can answer. When you guys raise your little hands, because I never do that, does it just show up on like your little screen? Like, where do it's on your screen. Someone raise your hand. Where's Katrina? Raise your hand. I always pick on you. I'm sorry.
I don't know how.
Okay. Okay, then we won't do it. So whoever's voice starts making noise first, you can answer the question. Okay, so my first question that I have is, why do you not apply ice to mainly 3rd and 4th degree burns? What would be the rationale behind not applying ice? So if you're at home, so I kind of split burns into 2 pieces, and I know who read my, by the way, who watched my video, I can tell by the quiz, by answer number 1, and who didn't. It's kind of funny, because I can just tell. 1st degree and 2nd degree, I kind of think of like you're at home, right? You're not hospitalized. 3rd and 4th degree, for the most part, if we have to make it black and white, and then 3rd and 4th degree, you're in the hospital. Of course, you're probably gonna have some 2nd degree and 1st degree if you have a 3rd degree burn, but for the most part, if you have those severity of burns, you're in the hospital. And if you have like just, sunburn or maybe a little blistering, like I had actually last week, just right here. I had a second degree burn, and when it's still actually healing, it's not looking very good. I would show you, but it's very small. So why wouldn't you apply it to a 3rd to 4th degree burn? What would be the reason why and the reason behind it? Does anybody know? If not, I'll give you guys a hint.
It decreases the body temperature
Who said that?
and causes vasoconstriction. Denise?
Dang, Denise, yesterday and today you're on point. Yes, exactly. Yes.
It's the coffee.
It's your brain. It is your brain. It's not the coffee. No, that's excellent. So yes, so your body does lose heat, as most of us know if we read the chapter. Once we get down to those layers, because what are the skin layers? We start with what? What's on top?
The epidermis.
And then the dermis. And then the hypo.
The hypo.
The hypo. There's that fat, right? And that's why I don't know if any of you have ever visited anybody or had any experience in any type of burn ward. It is hot as you know what. And they do that on purpose a lot of the time, because what I just said, many of the patients that are hospitalized are 3rd and 4th degree burns, and they have a lot of trouble holding in their heat. So they're freezing, they're cold, right? And we want to keep them comfortable. So imagine being a nurse taking care of that population of patients, and this is one of the NCLEX questions that I'm going to ask you, but you have to wear certain PPE in order to take care of these patients. It can be pretty uncomfortable. So it's kind of like how we got used to wearing our masks. You get used to it, right? So they usually keep it anywhere from like 85 to 95, like 98 degrees. That's pretty hot, especially if you're wearing all your PPE plus your scrubs and you're running around 100 miles an hour because you're a nurse and you're doing everything, right? Not everything, but you know what I mean? Like you're on top of it and you're running around. So that's excellent. There was another reason. This is that's the most common one, and that's the real reason, but there was another thing that I had read in an article about frostbite. You have more of a chance of getting frostbite when you put ice on a wound in that capacity. So basically just remembering that, because we think ice cold, okay, yay, but remember 3rd and 4th degree, you're not feeling pain anyway, right? Because those nerves are severed and damaged and singed. So ice isn't going to do anything for it anyway. But if you have a 1st or 2nd degree burn, as long as you're not holding it on there, because we know we don't hold ice on there for very long, right? We always tell our patients, no more than like 10 minutes. Usually I say about 5 minutes, because I know they're probably going to go over anyway. And you always put a layer in between. So does that make sense? Why we wouldn't put ice? I thought that was a really good question. I don't know where I got it from. Maybe it was in the book, but I thought that was a really good question. No questions about that? Heat loss, ice. Okay. All right. I'm going to repeat it again because a couple people did sign on. I am recording this. So if you, I said some stuff at the beginning, so I highly recommend that I'm going to upload this after, that you do watch it, because it talks a little bit about the new way that we're going to be doing things. I changed it one more time because it just made way more sense, and I have no idea why I didn't think of it before. Okay. Number 2. What is debridement and why is it done? And it can't be Denise.
Okay.
Thank you, though, if you were going to. Ben or Luis. That was Luis.
Yeah. So debridement, it removed the eschar and the slough so that we can have a granulation, the new vessel network to grow for healing.
Dang. Okay. Good verbiage too. I want to say that as a side note, and then I'm going to come back to that. I've noticed a lot of growth in your answers that you guys are giving verbally, especially because I actually get to hear your voice, and you're starting to sound more like nurses. It's really inspiring. I just wanted to kind of shout that out. Excellent answer. Very good verbiage. And it's basically, yeah, it's eschar is what? Dead tissue, right? We learned that hopefully in our quiz. And we have to remove that in order for new skin and new things to grow, right?
Yeah.
That would make sense. And there would be one other reason, and it has to do with infection. So why would we need debridement for infection? Let's say we're not sure. I mean, because it's kind of hard sometimes to tell infection with a burn. So why would we do debridement for that? And that could be for anyone. You don't have to answer. You can. But
okay.
You can, but you don't have to.
It's cool. I could. I think it's to remove the infection debris.
And then what would you maybe do with that skin instead of just throwing it in the garbage? Or, well, you wouldn't throw it in the garbage anyway, but throwing it in the, that thing.
Sure.
I'm sorry, Jessica?
Is it to do culture and sensitivity to check for bacteria or infection or what? Or the tissue?
Beautiful, beautiful, like your background. Exactly. Yes, that's exactly another reason that we would do that. We would want to look at the tissue, test for maybe what's going on, take a look under the microscope, test for bacteria, and then be able to give proper antibiotics. So that's another reason for debridement. So usually there's, like I've said, in every single body system and things that we do, there's usually more than just one reason why we do things. So excellent. Very good, guys. Looks like people are reading the chapters. Very good. And we already talked about eschar, which is dead tissue. I want to make one point only because on some of your answers when we were talking about the escharotomy is that, and this is what when I mentioned earlier, how I can tell who watched my video and who didn't is because they answered in the exact way that I explained it, or maybe they read the book as well because I went back and forth, is that it is mainly, actually, let me ask you first before, what is an escharotomy? And someone answered that has not answered yet. And then I'll take it a step further if need be. Because this is really important, very important. And it may be on your test. I don't know. I think it is. Because a lot of you, when you were so close, you kind of went around it and you got like part of it, but you didn't get the full understanding of what it is. Yeah, go ahead, Jessica.
So it's a linear cut on the burn, so that there's because the burn, especially in a circumferential burn, it constricts the blood. So they want to have they want that blood flow to go. Like, I mean, like it's not constricting it. It's like, I forgot the word.
Well, I like this though, because this is things that I would do. So yes, so that is correct in the blood flow. So it has a lot to do with circulation.
To relieve the pressure.
It relieves the pressure, but which is true. And more importantly, what I don't want to get confused is the fasciotomy. Exactly. You know, in Grey's Anatomy when they're like, Callie comes with her scalpel and like cuts people's legs open because there's like such bad, almost like compartment syndrome, and there's so much swelling and like the leg will lose basically all circulation and possible amputation. It's different. It does similar things, but it's done for a different reason. For example, chest expansion. We talk about that, right? For people being able to breathe and expand their lungs. So they do a lot of that on the chest. And that has to do with you're going below where the burn actually is in order for blood to basically rush to that area for circulation. And what does blood have in it? Red blood cells. It helps keep you alive. Say it again, Katrina.
Oxygen?
Exactly, oxygen. So basically the main reason for, and I hate this word, I have to look at it to say it. Why can't they make it easier? Whatever.
I think the fascia, to me, it cuts into the fascia, and and then escharotomy, it cuts to the subcut.
Exactly, the tissue, exactly. And that's the main difference between the two, and why they're done too as well. But you're right, It's going to remove the swelling. It's going to help rush blood there. And especially in the chest, if there's trouble breathing, it's going to basically give more chest expansion. So just understanding that having this procedure done has a lot to do with circulation and blood flow. You want blood flow, circulation, and you're trying to preserve that tissue as well, right? Because the longer that tissue doesn't have blood and oxygen, the more chance you're going to have of not having healing, right? You're not going to have as much healing, and that tissue is going to die. So it's a great thing to do. More than likely, if you watch my video, you'll know, is your patient going to be awake when you do this? Would that be nice? We try to sedate them, and even though it might be a 3rd-degree burn, we don't know how many nerves are still there. And imagine being through that traumatic event, or whatever just happened to you. Many patients that get burned are having a panic attack. It's very scary. They're having trouble sitting down. So we want to sedate them, and potentially they'll be intubated, and that we'll get to that in just a little bit. So we do sedate to just for comfort, and it's pretty scary to see a scalpel coming at you. Hey, I'm just gonna like cut you open. I would freak out, especially if you're already at like a level 4 anxiety, right? So we do usually sedate them for comfort and for anxiety. Okay, my next question is, why is when we have a flame fire, or so let's say there's a kitchen fire, or house fire, or fire where there's flames, why is there a higher rate, and please someone who hasn't answered yet, why is there a higher rate of mortality?
Smoke inhalation.
Beautiful. Exactly, Alicia. Smoke inhalation. And what happens when you have smoke inhalation? It could be Alicia or anyone.
It swells your airways, harder for you to breathe.
Exactly. So what is the first thing that, well, I mean, pretty much one of the first things we know, right? ABCs. But what are we going to do when we get that patient? Hopefully the paramedics have already done this, but let's just say, whatever, you're the nurse, you're on scene. What are you going to do when you see that patient? What are you going to look for, and where are you going to look immediately?
Make sure they have an open airway.
Exactly, an open airway, because we just talked about swelling, right? So if you have a flame fire, and anything, this NCLEX loves these questions, by the way. They love talking about burns on the head and neck and face, because this all has to do with our airway breathing, and circulation, really. But airway breathing specifically, because we can get a lot of swelling right here, and we're looking for, what is that word? If you watch Grey's Anatomy, and remember April Kepner, this is how she killed the patient, because she forgot to look inside the airway. Stacy, come on, girl. I know you watch it. We watch it together.
I don't remember that one.
There's an episode when they were merging. Sorry. I love Grey's Anatomy. And it really does. It brings it to life. It's called soot. What is soot?
I like from the fire. Yeah.
Right. So we open that airway, and it really is a swelling, but the soot, usually you'll see it. There's like the black flame will come from that, and you'll see that in the throat. So if I know that's the throat, what is probably going to happen? Swelling is going to happen. I need to get that person intubated now. Because if I don't get them intubated now, what's going to happen? I'm not going to be able to intubate them, because they're going to be so swollen, I can't do anything about it. And then if we miss that, then it's just a catastrophic. We try to then do the, tracheotomy, and we're doing all of these things. And usually by that point, the swelling has gone down, and it's gone down to the bronchioles, to the pulmonary system, and CO2. And then we get into all these, it goes down from there. And then we go into hypovolemic shock. And then unfortunately, the patient usually ends up becoming deceased. So not saying a flame fire necessarily always has to be the worst one, but that is the fire that's usually going to be the most fatal. So just keeping that in mind and knowing the reason behind it, because if we know the reason behind it, then we know how we can prevent it. So that's really important. Very good. All right. So we did that. And again, a couple more signed on. So this is being recorded. Please watch the beginning because I do talk about our new method in order to be more effective. Again, because we're still learning. Beautiful. Good job, you guys. Okay. So I have one more question. And then I have the 5-minute kind of psychosocial video that I want to watch together of the patient going through being treated for burns as well. If you watch the video, I talk a lot about, or not a lot, but I mentioned amputations. Have you guys ever, has anyone ever worked in a burn unit or been in contact, or I mean, maybe have a friend that's been through a pretty severe burn? Anybody that has like a real life situation? I don't.
My mom, well, I don't know if it was super severe. She burned one of her feet like with hot cooking oil. So she actually just talked to me about it yesterday. She explained about, when they had to debride it and everything, and she actually had taught me something about Silvadene, which I wasn't really aware of. I guess she said if a patient, people can be allergic to sulfa. And so sometimes that's why if a patient, their medical history isn't really known, they'll be kind of cautious in using that medication because they can develop a really bad allergic reaction.
Exactly. And would you mind telling us, was it a second-degree burn, I'm assuming, with bubbling, and she probably had a blister? Was it that?
Yeah, I think so.
Okay. And as we had talked about a little bit earlier, a lot of burns tend to be, it's not a perfect burn. It's not, oh, this is a, definitely a second-degree burn or whatnot. So her mother may have had a little bit of a third-degree burn too. So, and the debridement and what are we going to do before we debride? We talked about debridement earlier, and Luis gave us a beautiful answer. But what do we want to do before we debride?
Pre-medicate?
Yeah, medicate, exactly. And me of all people, when I was recording my lecture, I almost forgot that part of it. Medicating is very, very, very important. And I'm not going to talk much about it because that is one of the NCLEX questions I'm going to ask. I only have 3, don't worry. But they're questions just to review. Okay, perfect. Anything else about the burn? Does she have if you don't mind me asking, does she have a scar on her foot?
I think there's you can't really see it anymore, but you can you can tell if you were to really look at it.
Right, something may have happened.
Yeah, exactly. But I think it was so long ago that, it's had a long time to heal.
Exactly. And the body is very regenerative. And so I'm actually glad you gave that story, because now think of this story when we're going to watch this 5-minute video right now. So now we're going to see the difference of a burn, and not saying, no, I'm not going to say anything. We're just going to say that. Just kind of think of the two together. And I want to make that big point of saying, again, if you didn't watch the video yet or don't plan on it, I don't care if it's a little burn on your hand even, or a little burn on your face or whatnot, and you have a scar. It's, in my opinion, it's really, really important, now that we're talking a little bit about the psychosocial part of burns, is not to judge someone for being insecure about that, right? I mean, right now looking, and I don't mean to put you on blast, Celine, but your picture's beautiful. Your skin looks beautiful. I'm looking at it and I'm like, wow, flawless skin. And let's say tomorrow you are making food and oil splatters on your face. You could get a scar that's maybe just a ½ inch. And to, someone else are thinking, oh, that's no big deal. I know someone that has this, that, and the other, or you come in and you're my patient and you're very, very emotionally distraught about it. Keeping in mind that everybody has their own feelings about certain things, and keeping in mind to watch our affect and make sure that we're not being judgmental. I think that's really important. And Celine, you can say thank you now. Just kidding.
Miss Amanda, I have a question.
Jessica, I have an answer.
Okay, it's about roll of 9s, and then speaking of burns on the face. So when measuring the roll of 9s, is it just an estimate?
Yes, and that's why I tried to kind of and that trick you guys a little bit, and it backfired just a tiny bit on the quiz. Yeah, sometimes it has to be an estimate because, okay, think of an arm, right? It's the rule of 9, so we have 9%. But let's say it's like it's almost all the arm, but like this much. Are we going to say it's 8.7%? So we say 9. You know, so that it's never going to be 100% perfect. So yes, correct. Yes. And I have a question about the rule of 9. That's my next question.
Even if it's that small, it's still considered 9%?
Yeah. According to Amanda Kite. I mean, that's my research and what I read in my documentation. But I'm not a burn nurse, but yes, exactly. Because I mean, it's hard to tell, right? Just like I said, from first, second, third, fourth degree, there's always that crossover. Okay, so everyone turn their mind on. I'm going to ask you a rule of 9 question. So get a pen, or if you're good at math, don't get a pen. Okay, so you have a patient. This is my last question before we watch the psychosocial video, and then we'll do our NCLEX questions, and then we'll take any questions, and then that's our new Monday, and then we'll start our new Monday next week. So please, again, watch the video in the beginning if you did not, so you know what we're doing from now on, to save all of us a little bit more time and effectiveness. Okay, so we have a patient. I made this up myself, so that's why I'm looking here. So anterior arm is burned. The full chest, not stomach, chest. The entire back, upper and lower. And this is an adult. How much percentage, somebody that has not answered yet, would we put down?
It would be 36.
Oh God, did I do the math wrong? That's not what I got.
So arm, chest, and upper and lower back, right?
Anterior arm, so only half the arm. So the full,
Oh, okay.
31 and a half.
So that would be 4.5. Okay. Not
It would be 31.5.
yeah, I got it right too. I'm like, oh my God, did I do that wrong?
so
Exactly.
that would be half of the arm. Okay.
So that's why we really have to pay attention to the words, especially on the, what's that test you're taking? The NCLEX. We really, really want to look at that. And I'm sure half of you went completely insane trying to figure out my extra credit yesterday. Like, Miss Amanda can't add. I was just tricking you, or trying to. Pick the closest one, which 98% of you did. But so yes, so anterior arm, just half the arm. So half of 9, 4.5. Chest is 9. It's not, said nothing to do with the abdominal area, which is also 9. And then we have our full back, 9 on top, 9 on bottom, and then that's going to equal 31.5% for an adult. Very good. Is adult and children, they're not the same? What about infant and child?
The difference is I'm sorry. This is Gilala. So the difference between the adults and the child is just the portion of the head. So the children will consider 18%, whilst the adults is 9%. And the leg, it would be 14% each for left leg and right leg, whilst adult is 18%. Everything else the same.
And what if you have a 3-year-old and a 9-year-old? Is that going to be to the whole class? Is that the same? Is that still considered a child? Their body be considered the same?
That's hard to tell. So 3 years old will consider use the child, but 9 years old is kind of in between, because the 9 years old, the body proportion of the head and the body is slightly different from the 3 years old. I'm not sure what age that we can consider for that, but maybe the same.
You know what? I'm not answering that question. Watch my video. That's what
Okay.
Katrina's Have you never seen me be mean? That's the first time ever. Okay, yeah, so it's in my video. So y'all watch my video. The burn video I think is pretty good. All right, so let's watch this courageous patient for 5 minutes handle burns. I hear nothing. Oh, that's me. I'm all, what do you mean? All right. Mhm. Mm-mm. I want this one. Put you down.
And counting. That's what it's taken to keep a burn survivor alive 3.5 years after a helicopter crash left him with burns on more than 90% of his skin. Dave Repsher knows he owes his life to the staff of University of Colorado Hospital. Chris Vanderveen shows us what this journey has been like so many years after a Flight for Life helicopter went down in Frisco.
There were times that Dave wasn't just the sickest patient in the burn ICU. He was the sickest patient at University Hospital.
A ketamine-induced coma kept Dave Repsher in a 5.5-month black hole.
I didn't know the passage of time or really where I was or really anything, I guess.
And then one day,
I didn't know where I was.
Dave woke up.
I mean, I was freaked out.
And said 4 words.
And I knew that whatever Dave's decision was, I was gonna respect it, as horrific as it might be. Getting up the next morning and getting over to the hospital, and I got to Dave and I asked him, I said, do you remember yesterday? And he said, yes, I do remember yesterday. And I said, do you remember what you said? And he said, yeah. I said, I want to die. And I said, do you still feel that way? And he said, I don't think so. No.
From that moment on,
you are riding the bike by yourself, Dave Repsher.
Dave moved forward.
This is a monumentous day.
You know, I just had to know what I was facing, and it's like, can I get through this? And at some point, I guess I said, well, let's give it a shot, see what happens.
I would say he's 1 in a million. He was near death so many times. I can't even, literally near death. And I'm not exaggerating that.
Unusual patient, Dave?
I wouldn't call him unusual, I'd call him special.
Extraordinary.
Extraordinary.
Under the care of people like Dr. Eric Wichter.
Dave, you're walking.
Oh my gosh, your gait's better now than it was the first time. Oh, what else?
Yeah, there isn't a textbook that you can read about this.
Dave learned.
You're gonna walk the entire length of this hallway, Dave.
Learned how to be Dave all over again.
It takes a whole hospital of people to get them better.
I've worked all over the hospital, and I truly believe this is the most painful injury you can have.
And I would have to go in and say, Dave, this is what we want to do today. It's going to be very difficult. It's going to be very painful. Are you sure?
Oh, the pain for him was phenomenal. You could see it in his face.
You're just not sure when you're getting to that level of care, what's going to work and what's not. And you aren't sure if he's going to make it through the night. You leave, you go home from your shift and you come back at 7 a.m. and peek in the room. Oh, he's still here. Thank gosh, because I didn't sleep that night. I didn't think he was going to make it through the night.
I had multiple nightmares about Dave passing away. I think most everybody did.
It's really hard to put into words seeing someone that you thought was dying actively to being better to then maybe dying again and then walking in front of you.
You are so amazing.
Recovery for Dave came in steps.
Ready?
A nurse by trade, Dave refused many of the heavy-duty pain medications typically given to burn patients.
And we would warn him, and we'd be like, you sure? We can ask for some. We can have some on hand. Most of the time, he didn't want anything.
Yeah, he's a tough guy.
Steps.
you always got to try to do something more the next day. I just can't get it. If you made 10 steps, the next day go for 11. The next day go for 12.
You got it, Dave.
Good work.
And then one day you go right out the front door
Oh my gosh.
with the one person who's been by your side since day one.
Yay.
And he's out.
It was everything. I wouldn't be here without her. She came every day. Was there all day. I look forward to hearing her voice or seeing her every day. And I was in some really dark places, and just to hear Amanda's voice, I know it brought me out of some places that I didn't know if I was ever going to get back from. And
This weekend, 9 News will show you more of Dave's survival story. Fueling the Fire airs commercial-free Saturday.
Okay, wow. So am I the only one crying? Anyone else? Jeez. I watched that video last night when I found it, and I thought it was such a good depiction of not just the psychosocial, but what people that have such severe burns, what they actually have to go through in order to get better and survive, and how it just, you never know what's going to happen. And I'll just say it. So one of the biggest reasons for that is because, like I had mentioned earlier, is your whole entire body is affected when you have a burn, especially as this gentleman did from the 3rd to 4th degree burn, your entire system. And if you haven't watched my video, I talk about the systems more in length. So that's why I'm not doing that in this moment. Any comments about that video? I thought that, I just thought it was very on the money, if you will, of what I'm trying to depict of burns. There's many types of burns, electrical and, the water burns and flame, radiation, chemical, electrical, there's all sorts of burns. But does anybody have any comments or suggestion or anything they want to say about that? Feelings? No? Okay. Whew, all right. So what I'm going to do at this point, as I said in the beginning with the expectations, I have 3 NCLEX questions I want to ask you. I have the fluid loss video that I suggest of watching. That's 10 minutes. We can either do it together, or I can just post that one, because like I had said before, since I do the video then this, I don't want to keep you longer than an hour, except for as of next week, we're doing everything on Mondays. We're doing the whole lecture. We're doing everything on Mondays together, and NCLEX question, everything, the whole thing from 8 a.m. to 10:10 with a break, of course. So let's vote. So if you guys want me to, we'll do the 3 NCLEX questions and then questions about anything, and then we'll end our session, or we will watch the 10-minute permeability of why dehydration is because I don't think I explained it very well in my video. I want to make sure that you really get it. And so, of course, Sarah from nurse.com, she just explains it beautifully. And then I was like, oh, duh. Okay, that's how I should have said it. So press yes if you would like me just to post it. So, and I'll tell you what number to what number to what she talks about the permeability as far as the time of the video, or if you guys want to watch it here, because I know that you're all tired and you have Miss Carol as well. So press yes if you want me to post it, no if you want me to play it here. I don't care. Okay.
Are you going to post the link to it after, if we do watch it?
Of course.
Okay.
Yes. Okay, so let's just do the NCLEX questions while everyone's finished doing their little yes and no's so that it's fair. Okay, so as I said earlier, I'm actually going to read them to you, so you have to think more critically rather than me just like Louise, put it this way. Someone private typing you, Stacy, making fun of me. You're laughing.
No. But just what Lewis said was very relatable. He said, watch it here. I might forget to watch it later. Or of my life.
I don't even see that. Oh, yeah. Oh, Louise. Okay. So I'm going to do what Hartnell does, and this is their method, just for fun, again, to switch things up. And I'm going to read the NCLEX question rather than how I usually do it, so that you're getting it in a different way into your head. So I have 3 questions for you. And whoever answers it has to explain to us why they picked this answer and how they picked it and how they got to the answer. That's what's important, right? So, number 1, a patient has an emergency escharotomy performed on the right leg. The patient has a full thickness I can't talk. Say it, Stacy.
Circumference.
Thank you. Burn on the leg. Which finding below demonstrates the procedure was successful? Okay, so we have a patient that had what procedure done we talked about earlier. Luis, explain it to us.
Escharotomy.
Mm-hmm.
It's like incision,
Mm-hmm.
and then it's to increase the oxygen and blood supply.
Beautiful.
So a patient can breathe better circulation.
Or if it's on their leg, it will help get more circulation to that part of the leg, therefore keeping it alive. Beautiful. Good job. Okay, so what's going to tell us that this procedure was done successfully? A, the patient can move the extremity. B, the right foot's capillary refill is less than 2 seconds. C, the patient reports a new sensation of extreme pain. Or D, the patient has a positive Babinski reflex. Now remember, this is a full thickness burn. Moving the extremity, capillary refill, reports new sensation, or Babinski. We know D is not right, because that's babies. So it's either
capillary refill.
Refill.
And why? I think who answered it first? Was it Katrina?
Okay. Oh, well.
Was it? I'm sorry.
It's okay. I don't know. I don't even know. Or okay, I'll just go. So capillary refill.
Yes. No,
because you're doing the escharotomy to promote blood circulation, so you would want it to improve. So you look at the capillary refill.
Exactly, because that's why do we check the capillary refill in an examination? Exactly. Clap of hands. That's perfect. And on the spot, was it Stacy that answered? Because who originally answered the question?
It was Katrina.
Oh, it was. Okay, cool. Yeah. Well, because I'm starting to get your voices. Like I know who's who without knowing who's talking. Okay, excellent job. So does that make sense to everyone? Because that's the point. We want the circulation, we want the blood, we want the oxygen. And so if we check the capillary refill of that, let's say it's in the leg, what capillary refill are we going to check? The finger or the toe?
The toe.
The toe.
Pedal pulse.
Toe. Thank you, everyone. And pedal pulse. Excellent. I think it was Ellie that said that.
Yeah. Yeah.
Excellent. Very, very good. Okay. Next question. Your patient with a severe burn is due to have a dressing change. You will pre-medicate the patient prior to the dressing change. The patient has a standing order for all medications below. Which medication is best for this patient? Someone that has not answered yet. And I will not pick on you, Katrina. A, intramuscular morphine. B, PO morphine. C, IV morphine. Or D, sub-Q morphine.
IV morphine.
And why, Denise?
You don't want to inject them if they have burns. The IV just goes in there continuously, and you can adjust it easily.
Exactly. And you mentioned something that I didn't even think of in the moment, but A, of course, IV morphine goes in the quickest, right? So they're going to be medicated the quickest. And if they're usually people who have burns, severe burns like this patient, will have 3 lines. They may have a central line and then 2 lines running in. Wherever they can get lines in, they're going to have lines in, right? Because dehydration is such an issue. Usually eating is an issue, and I talk about that, I think, in my video. If I didn't, it has to do with distress of the GI tract, having to do with dehydration, immobility, opiate medication. So we want to be as nice to the GI system as possible. So we definitely wouldn't want to give it PO, and that takes the longest anyway. And it causes more irritability to the stomach because the patient's usually NPO, which is why they have a central line. So absolutely IV. And then if this person has severe burns, why would you want to poke them anyway? Even if they didn't have burns, we don't have to poke a patient. Why would, put it in their IV, right? Needles aren't fun, and people usually don't like them. And then let's just use where we already have a opening into the skin. So excellent. Very good. Any questions about that?
I have a question.
Yes, ma'am.
So if a patient is severely burned over like the majority of their body, how do they keep the catheter in place?
It depends. So usually they'll end up being very creative. So depending on, I'm not sure how many of you are exposed to working in the hospital or have seen IVs, but you can put an IV anywhere there's a vein. So, I've seen veins in the toe. I've seen veins, and a lot of my patients that are addicted to drugs, the veins are shot, right? Mm-hmm. And that's usually why they try to get that central line in. So they find very interesting ways, sometimes even in between the fingers. It's not the best place because we want to, people with burns especially, kind of like women that are having babies, we want to have the largest lumen possible of the needle just in case there is like a crisis and we need to get fluids in immediately. Excellent question. And I anticipate
they just go for a non-burned line of access, I guess.
Exactly. And that's an emergent situation. And then there might be then some debridement done so that they can get to that area. So maybe an hour after admission, once things are kind of stabilized, they may do immediate debridement to get to an area, depending on how deep the burn is.
Yeah, I can just imagine imagine being burned on your arm or somewhere and having a tourniquet put on,
yes.
Oh.
Yes.
Or they probably don't even do that. They probably just go blind, I guess.
I was thinking the same thing when you said tourniquet, and I think it depends on the patient and it in the video.
And the nurse.
I was just gonna say on the nurse, and they get so creative. We get so creative in our specialty. It's amazing. I just can't wait for you guys to finally be on the floor and be like, oh my God, your critical thinking gets just so, it'll be a proud day. Like I said, you'll text, or this is yesterday, you'll text me and say, oh my God, Miss Amanda, guess what I did today? So excellent question. Okay, now the last question we haven't talked about. So let's use our critical thinking. So you are about to provide care to a patient with severe burns. So let's say a 3rd to 4th degree burn. Let's say a 4th degree burn. Muscle and bone is included into this burn. So it's a 4th degree burn. What are you going to don? So what are you going to put on, basically, as far as your PPE? I'm thinking, should I just have you, I'll just give you it's a select all that apply. So start writing it down or think of it. So what are you going to put on? I'm going to provide care to my severely burned patient. A, gloves. B, goggles. C, gown. D, N95 mask. E, surgical mask. F, shoe covers. I've never seen it go to G before, but our last one, G, is a hair cover. So I'll say them again. A, gloves. B, goggles. Gown. N95, surgical mask, shoe covers, and hair cover. So someone who hasn't answered yet, what do you think?
A big hair cover.
You've talked. You can't talk anymore. After the class, you can talk. And you can even guess one. We can do them one by one. So someone who hasn't talked. Okay, we know we're gonna need gloves. So Miss Amanda's gonna start. Of course, we're gonna need gloves, right? Wash your hands, put some gloves on. Okay, we know we need gloves. Do we need goggles? We'll do this together. Do you need goggles? No, you don't need goggles. There's no splash. Now, if I was doing an whatever otomy, then I probably would, just in case, because what if I hit like a vessel and blood starts squirting? But that's not what the question asks, so I'm not going to make that up, right? I'm not making up my own question. So no, goggles is a no. So we have gloves. Should we wear a gown?
Yeah.
Heck yeah. I would definitely wear a gown. We want to have that protection between ourselves and the patient, and to help prevent infection, right? So we want to have that gown on. What about, do we need an N95 mask or a surgical mask?
Surgical.
Surgical mask, because all we're trying to prevent, they're not I'm not going to get infected with their burn, right? I'm just trying to avoid my breath from touching their burn to avoid infection, because your mouth is dirty. No matter how, if you brush your teeth or not, your mouth is dirty. Okay. And then the last one will be a hair cover. This one I think is the hardest one. And it actually is, yes, you would want to wear a hair cover. And why? It makes a lot of sense. I mean, we lose a lot more hair than we think we do. But we don't want any of our hair or fake eyelashes falling into a patient's, you know, so I would probably wear goggles or something to cover my eyes, because I get eyelash extension. So for me, again, I'm going to critically think that could possibly happen, and I don't want that to happen. So I'm going to do this for my patient. But I guess, I mean, a real eyelash, and okay, let's not get crazy. So your hair, why would you wear a hairnet?
You don't want to shit on the patient.
Exactly.
It's like food. You wear a hairnet.
Exactly. Who said that? That's exactly right. Perfect. So does that make sense, what we were going to be wearing if we're taking care of a patient with a burn? Gloves, gown, surgical mask, and a hair cover. And that might be, that would be a good NCLEX question, actually. That one came from Kaplan. So that's a question you might actually see on your test. Good. Okay. So I have asked the questions that I made up in the beginning. We talked about, which you answered all beautifully. We reviewed something from the quiz that most of you got partially right. Most of you, it was all over the place. So we explained that. We went over the NCLEX questions. We watched the video about psychosocial. Again, good job on your quiz. Reminder that you have a test this week. And then we have that 10-minute fluid loss video. So we'll just go ahead and watch it here. It's about 7 minutes, and it's a clip of the video talking about why dehydration, because dehydration is one of the biggest things other than soot from the throat and the swelling that is going to be in any burn that can happen, electrical, any type of burn, dehydration, which is a huge catastrophic part of why a lot of the other systems go down. Why do you think renal issues start to happen? And then cardiac, right? So if you're dehydrated, you're gonna have issues with your renal system, then your renal system's gonna cause cardiac issues. Because cardiac, you're gonna have decreased output. And if you have an electrical burn, then what could happen? So let's say you have a pretty bad electrical burn. Is your heart an electrical system? Partially? Yes. So you could have dysrhythmias. I mean, it affects the entire body. I've said that 18 times because I want you to remember that. Okay. Any questions before we watch the video on why dehydration happens with the permeability? I talked about it in the video about albumin and all of that, but I think that she explains it better than I did. So I wanted to make sure you get that. And then I will post that as well. Wait, no, I don't have to post it because it's on this. And then you can just fast forward it.
Question.
Yes, ma'am.
I think there was it in the workbook? There was a question on electrical burns. I don't remember where it came from.
With the bone?
But, huh?
Would that have to do with the bone?
Yeah, or it was an electrical burn, and then there was like there was an area of ischemia that the nurse had noted. I think that was in the workbook. I'll message you after and ask you about it, because it didn't really like make sense to me on how electrical burns happen, because I looked it up online and it was saying somewhere that sometimes it like happens from the inside out, you know, with like the muscle, and then apparently you can get like compartment syndrome or something because like the muscle cells are damaged. I don't know. I'll have to find the question and send it to you after.
And then I will put it on the announcement so that everyone can see it, okay?
Okay.
Thank you. All right. I know some of you hate her. I'm sorry.
Would you consider
not Stacy, the girl that I'm pulling up. Sorry. Go ahead, Jessica.
would you consider a electrical burn? It's like a gunshot wound. Because there's exit and enter wound.
I would not. But there is an entry and an exit, like if you were struck by lightning, or that's always what I think of, or rewiring a phone or something happens in it, sparks, and then you're burnt or whatever. But I wouldn't, only because it's a different type of tissue damage, and it's I don't even know how to explain it.
It was just, I was just thinking because sometimes the gunshot, the bullet, when you shot someone, it's spread, it's scattered, like when it hits something.
I would say that's it's kind of like a knife versus a gun too, right? So it's like there's an entry and there could be an exit wound. So I mean, they're all wounds. They're similar, but they all host their own complications. That's how I would answer it. And I usually think, when I think electrical burn, as Stacey had said, or we said, I think together, I think of bone, because it tends to potentially have issues with bone and compartment syndrome, where a gunshot wound, that might not be the first complication I'm thinking is blood loss and infection. Does that make sense?
Probably I was just thinking like another bullet of the gun, because there's different types of bullet. So one, it can scattered, and then it can go to the bone, shatter the bones, and then and then can affect the muscle. I don't know. Probably I was just thinking of one of the other types.
Do you have a
gun?
gun?
And I think it might help to just remember electrical burns. There has to be like a source of electricity or current. And I don't think that would be able to like provide that. But I think I know what you're talking about, how some of the bullets like.
I was just thinking like I get that the electrical force that I was thinking of, like how it, like the gun, there's a force to it, and then also electrical has force. Now I'm thinking right now, force for electrical can be scattered all over the place.
Sorry, am I frozen? Can you see me, Jessica? Okay, good. I was gonna ask you a question, but then I didn't want to say. I know why you're asking that question now, because I remember when we were talking about your asthma that one time, where you were before. So you know a lot about guns, so don't mess with her. Celine, thank you for that. That's a really good example. The electrical burn, changing a car battery, and it's affected his arm, and now it shakes. Yeah.
I think I'm just talking about the force. That's all, like the force, the physics part.
I would say yes, depending on what kind of gun. If it's a rifle, it's going to be completely different than if I don't know much about. I watch like Forensic Files every day, but a rifle is going to be different than like a baby gun. But yes, the entry and exit, correct. And the shattering, if it shatters, it can shatter the bone like an electrical burn can do. So there are some similarities, yes, because it's a wound. I'll give you. Oh, yes, ma'am.
Quick story.
Yes.
Sorry. One of my friend's husbands, he's actually an electrician, and a transformer recently like blew up in his face while he was working on it. But he didn't have an electrical burn. It was more so it was like his face, like his eyebrows got like completely burned off. It was just like he just got, his whole face was like singed, his hair was singed, and then he had to get like flown into the UC Davis burn unit because it was just like so bad. His arms, his neck, it was crazy.
Almost like chemical, kind of, even though it's electrical, because it didn't. That's interesting.
Yeah, because it wasn't from the electricity; it was from like the explosion.
Yeah.
So I guess it would be a regular burn, right?
Yeah, it would be. I would consider that almost. Would that be flame or chemical? That could be a little bit of both, actually.
Oh, maybe. Yeah, that's true.
Yeah. How's he doing?
A lot better. Like, you can't really. I think his burns, like, he had a lot of them, but they weren't like super bad. But like, he's all like healed up now. But I remember seeing the pictures of like his whole, like, you could see his whole epidermis just peeled off, and his skin was just all bright pink on his face, and it was made me cringe.
That probably hurt really bad.
Yeah.
Especially your epidermis and your dermis.
Yeah.
What stage he was at? Probably 2.
Yeah, I would assume so. I mean, it was pretty bad. Because he had a lot of blisters actually too, and they ended up having to like pop them all. And
oh God, and that hurts. Oh, that hurts. Yeah. You know, the stove we have all done that. Oh.
Yeah.
Thank you. I don't have very many examples of burns, so I appreciate your guys' examples.
Oh, one last one. Look up Steve-O recently burned himself, and he had this huge, like, coming down to here blisters filled with fluid because he literally like exploded himself in his living room, and they like caught it on video.
On purpose?
Huh?
On purpose?
Yeah, he was like doing a stunt or something. So if you're ever bored and want to take pictures,
I'm ever bored. I love it.
just Google Steve-O severe burn or something, and all the pictures will come up. It's really nasty.
Maybe I'll put it on because I'm being evaluated right now. So maybe I'll put it on because I know Lynn's looking, because Lynn's my tenure team. Oh, I'm recording this. Whatever. I think it's okay to say that out loud. I should put that, and she'll be like, "What are you doing? Why are you putting videos up there?" I mean, it's a good example, right? Don't burn yourself. And that that is actually self-mutilation, you know, for cutting. How a lot of people will cut in order to help with anxiety and depression and take away pain. Burning is actually considered self-harm, just as a side note. Had to throw my psych thing in for the day. Okay, so we'll watch our 7-minute video on the permeability and dehydration, because that's that one. If you don't want to watch it and you want to do it on your own, you're more than welcome to not be on. You can leave if you would like, and then you can come back and watch it. So for that reason, before we watch the video, does anybody have any questions about anything burn-wise, quiz-wise, test-wise, class-wise, life-wise? Okay, just want to make sure. All right, so we're going to watch the video. If you leave, I will not be offended. You will just come back and watch, because that's all I have for today after the video. So this is Nurse Sarah from Sarah.com, and we're going to watch 7 minutes of her talking about the dehydration part of burns after we make this one go away. Oh, no, don't leave me. Okay. All right. Here she is. Okay. So we're not watching the whole thing, just the part where she's going to talk about this.
Because it makes so much more sense why we are doing this nursing intervention based on what phase this patient's in and what's actually going on during this phase. So it helps you remember it better. Okay, what we're talking about, whenever we have a big change going on in the body, and as you're going to see with burns, it literally affects everything. That's why patients can die from this. What we're talking about is a severe burn, like one of those full thickness burns, or we're talking about where they've had all those risk factors for burn severity, and they've had a high percentage of their body burn. They're going to go through this. They're not going to go through this if it's like a really minor burn. So keep that in mind. Okay, so we have a really bad severe burn. The patient is burned like 40% all over their body. We're going to have a major change in capillary permeability, and this is going to happen fast. About 20-30 minutes after burn, this can happen. And what happens is that we have our intravascular space. So be thinking that that's where we are right now. And within that, what's in that space? We have our blood, which is plasma, and suspended in the plasma are red blood cells, white blood cells, all of the substances in our body that we need to survive. Well, that capillary that's really holding that changes its permeability. And in a sense, what happens is that plasma starts spilling out of that intravascular bed, and it leaves the intravascular system and goes into the interstitial tissue. So it's leaving there, and what's going to follow that plasma as it's leaving the interstitial tissue? Sodium. So our sodium level is going to drop. It's going into the interstitial space, so the patient can have hyponatremia. Also, albumin can follow as well and move outward. Now, we've talked a lot about albumin. What does albumin do? It regulates oncotic pressure, which helps, in a sense, in a nutshell, regulate the water within that intravascular system. And if you lose it out of the intravascular system, the water, the fluid is going to space other places other than there. So we're going to have problems with edema even more. Now, because we have depleted our intravascular system, that plasma has left that nice capillary area, what do you think is going to be happening to all the other substances that are left in there? It has no fluid left to suspend it. It's going to become really concentrated, specifically the hematocrit. So you can see an increase in the hematocrit level, and then whenever the patient is replaced with fluids, the capillary permeability stabilizes. In the acute phase, you're going to actually see a decrease in it. So remember that. And another thing is that the blood is going to become very thick because the plasma is gone, and this is going to affect microcirculation as well because it's just really thick inside those little areas of microcirculation. Potassium, what do you think is going to happen to potassium? We have an injury to the burn, the cell is affected, it's messed up, and what's nice inside of our cell? Potassium. Well, whenever that cell breaks open from the damage, it's going to leak potassium into whatever's left into that intravascular system. So we're going to have hyperkalemia. Our potassium levels will increase. White blood cells, they're going to go down. They were there as well. They've been injured with this injury. Also, those immunoglobulin, those proteins that help us fight infection as well. So from a nursing standpoint, we got to watch for infection. We've got to do things to prevent infection because they don't really have a system to help fight infection. Plus, they just lost the layers of their skin that help protect us from infection as well. We've got to watch for signs of hyperkalemia and hyponatremia. So we've established that that intravascular system has no fluid in it, which isn't good because that fluid plays a huge role in allowing our heart to pump all the blood to our vital organs. So if you don't have a lot of fluid for the heart to pump, what's the heart going to do? It's going to try to increase itself to pump harder. It's like, if I can work harder, I can pump more blood. So you're going to have an increased heart rate, but there's nothing really to pump, so cardiac output is going to go down and blood pressure is going to go down. Well, our vital organs suffer from that, and they don't like that, and they can die, especially our kidneys and our GI tract, and all that's going to be affected. And the patient can enter into hypovolemic shock. And that's the big thing we're trying to prevent in this emergent phase is hypovolemic shock. And that's why we're throwing all these fluids in on this patient to prevent this from happening because we want to maintain the function of those organs. So now let's talk about those organs that are being affected. First, the renal system, the kidneys. Okay, initially our patient is going to be aughluric because of what is going on and the fluid volume deficit because all that fluid's moving out.
Okay. So everything else that she's talking about is extremely interesting as well. So I am actually going to post the entire video. I like this video. I only didn't post it from the very beginning. I did the 4 that I got a lot of good feedback on. And I didn't want to overload too much of you. it was just so much information, but I think that this is an excellent video, and the whole entire thing. I did mine, and then she does hers, and hers I believe is a little step up higher than mine because she goes into a little bit more detail. But again, I try my best to, not that I don't think the detail is important, but I really want you to be able to remember and capture what is the most important thing so that you remember it. So I'm just going to say that again. But maybe there's something that you're really interested in burns, because maybe that's your specialty that you're interested in. So her video will be helpful. So I will post her entire video. I think that is a good idea. And so one thing that I don't know if she mentioned this, the whole thing that starts this cascade that she just talked about with the permeability of the capillaries. So we know the capillaries are the beginning of the blood supply, so to speak, is inflammation. So just, and if I guess you remember one thing, it starts with inflammation. So in your book, you know, it has like, oh, fluid balance, cardiac, GI, renal, it talks about all these other things. So under the fluid balance, it basically, that's where it explains, it's just like this little tiny chunk though, so it doesn't give you much. That's why I wanted to do something more. It mainly only talks about inflammation, and then it just says makes permeability more, and just a reminder, permeability means allowing to go through. So basically we're losing our fluid from where we want it to be. Where do we want the fluid to be? That's a question, sorry. And I said it like I was going to answer. Where do we want the fluid to be? So we have increased capillary permeability, which means it's leaving our intervascular tissue and it's going into the interstitial fluid, which causes the edema. And that's not what we want. And a lot of that has to do with albumin. And I really, really wish I got to do I do that in GI? That's part of the GI system. I hope I really do, because that's a really important part of our body system in general is albumin. That big protein has a lot to do with where your fluid in your body ends up being. So I think that kind of those take away. Okay, so inflammation increases the capillary permeability, which we don't want, because we don't want it to leave, because now it's leaving and it's taking our plasma. And what's in plasma? Blood. Oxygen, because we have our RBCs there.
White blood cells.
Exactly. There might be one more thing.
Platelets.
Yes, exactly. So we have a lot of things that are very important in this plasma that is housed in our that permeability that's being basically spilled out into the interstitial fluid, and now we're losing that in our intervascular fluid, which is where we want it, right? And as I didn't want to go too deep, so I didn't do this, but that's why certain IV medications would be given. We don't do IV medications in the VM program, but we would do certain things like lactated ringers and certain IV fluids that are going to help boost and push fluid back into the vascular system. Therefore, that's where it should be, right? We don't want interstitial fluid to be just leaking out. I think you all get that. I think we've reviewed that, not maybe in this class, but just in general, that her video, hopefully between my video, and even if you don't watch it, that's fine, that and then this explanation hopefully gives some sort of idea of why dehydration is happening and why it's so important to pump them full of specific fluids, because those specific fluids that we choose are what is going to make that fluid go back from the interstitial fluid to the intravascular fluid where we want it to be. Because why? Cardiac output, renal, it affects everything. Does that make sense? For me, that's the hardest part to understand. So I just want to make sure that we're all different, but that was the hardest part when I was learning about burns to understand. I'm like, why? It doesn't, I don't get it. The heat I could get because that fat layer, the hypodermis, but this I just couldn't get. I get it now, but okay. So I will post that full video. So if you want to watch it, it's fantastic. I think she did a fantastic job. I really like her personally. I think she does really good videos. I think sometimes she goes into a little bit too much depth, but again, that's my opinion. So I take what I want, leave what I don't. Take what I want. Yeah, take what I want, leave what I don't. Okay, so that's all I had. We did my questions, the NCLEX questions. You guys answered everything really, really well. So that means either you read, you watched the video, you did something. Your quizzes were very phenomenal, except I haven't graded, I think, 7 of them. So we'll see if that trend continues. And I guess I'll just say it real quick now that we're just all here, and then we'll be done if you guys don't have any questions. So from now on, and I say this at the beginning of the video if you don't watch it, since we're just here, I had a conversation with a student who made a very good suggestion that I think is going to be beneficial to all of us. Again, I am not perfect and I don't see everything, and not one thing is going to make everybody happy, but I think this is just such a better idea, and I'm not sure what I don't know what I'm doing sometimes. I think I make things harder on myself. And so what I have decided to do is I can do the lecture on Monday, because a lot of you do come. And so starting next week, we're going to kind of change our system again. But I think this will be more effective for everybody. I record it. So not only are we doing the lecture, you're asking the questions, and students don't have to watch 2 or 3 videos. They can watch 1 video of me doing everything at the same time. And maybe I'll throw in some NCLEX questions one day. I usually will. I like to throw in 1 or 2 or 3 if we have time, and maybe throw in, short videos just for those visual learners. And then we do everything at once. And I thought it was such a great idea, because as I mentioned before, and this isn't pity me or poor me, but it takes me about 5 to 6 hours to do the entire video, to prep for the video, do the video, pause the video because I make a mistake, erase that part, download it on Zoom, and then download it on YouTube because it's so long, and then downloading it. And so, and I can imagine you guys then having to be like, God, now I have to watch 3 videos. And part of it, I'm not going to lie, is repetitive, right? So I thank that student. So thank you. And I'm sure that student was not the only person thinking that. So I'm pretty excited about doing that, especially for this next one where we have 5 chapters in 3 weeks. And I will do my very best. You will notice as I start adding stuff that I'm going to do my very, very best, not to make it easy. That's not the point, but to make it manageable. So your tests might be a little bit different, or quizzes. Your test is going to have less questions, things like that. So again, if anyone else has any other suggestions, please don't think that it's punitive. No one's going to get in trouble. Like, I appreciate, as long as you're polite about it, I really appreciate it. The suggestions. I'm new to doing med-surg on Zoom in person. This would be totally different. And we'll use our PowerPoints and do that whole thing. So starting next Monday, we'll do our new way. And I will make probably an announcement actually about that as well.
Are we still having quiz after that lecture, or like the quiz, like instead of doing quiz before the lecture, do we do still quiz like after the lecture?
So the reason I have you do the quiz before, I know that seems funny, is because a lot of the time the quizzes that I give you should come from your reading. And you can tell me, please, and I said this in my orientation, so I didn't want to repeat it, but do you guys realize where I get the quiz questions, right? If I give you 5 questions, 4 of them come literally from like the back of the book. So if you do the back of the book, and I spend that extra time going through the workbook, because the workbook doesn't give you the answers, which I did yesterday, giving you all of those answers. I've already done that all for heme and immunology. So that's why I give the quiz before the lecture. Now the test, I wouldn't think that would be, I guess, fair, if you will, but the quiz, and there's just no time. I mean, please give me your feedback, other people, if you want to type in or talk about it. I just figured most of the time I take it from the back of the book, and so, or if I don't, I'll change it slightly or do something like that, because they compact this. It's kind of ridiculous, personally. I'm being recorded. But I mean, it's such a small amount of time to fit everything in. I'm like, how am I supposed to fit all of this in? And we have to have a certain amount of hours that you spend outside of class doing things. So I'm kind of like, would you rather do a 5-question quiz where the questions are in the back of the book, or this, or an activity on top of another activity, and then a presentation or a group project? So that was kind of my thinking. And again, not everyone's going to be happy with it, but what do you guys think? Like, do you guys want to do the quiz on, we can change it to Mondays. I'm fine with that. I really, that's totally fine too. Because that's only, what, is that one day? What day do we do it now? Sunday, Monday, Saturday to Sunday? So do you guys want to do it Monday to Tuesday instead? I think I did that because of clinical, but it's only a quiz. It's 5 questions. I guess it's not that overwhelming, is it?
I don't see a reason to change it unless anyone else has issues with the current time.
And that was kind of my reasoning, because people have clinical Monday, Tuesday. It was kind of, I try to do things more on the weekend, just so trying to make it have more time, I guess, if you will.
I've been taking the quiz after the lecture.
Okay. Well,
I feel like
oh, because the one I pre-record. I see what you're saying. If I start to see from this next quiz that people are not doing as well as they were, or there's a trend, then I'll take a look at that. And right now I like having it on Saturday, Sunday, only because also when we then switch and I have to give you a test at the end, there's not, especially for this one, I'm like, how the heck am I going to fit it in? So I'm looking at the schedule right now. I'm making everything, actually right now I'm having the quiz open sometimes on Thursdays and then close on Sundays. Cause I'm like, these poor people need time, like, oh my God, to have time to fit that in. Or potentially maybe I'll just open it from Saturday to Monday. How about that instead? Then everybody's needs are met. And really, I mean, what does that do? Nothing. It does nothing other. I mean, you're gonna, like, again, if you're gonna cheat, you're gonna cheat, but you only have that 30 minutes to do it anyhow, which is more time than any other instructor gives you, I believe. So I'll probably get talked to you about that too. So how about we do that?
So I'm trying to understand. So we're gonna do the quiz, like,
I'll close it on Monday.
The quiz?
So
after the lecture?
So every quiz is gonna close on Mondays at 11:59. So you can choose. So if let's say Celine wants to take it on Saturday, it's gonna be open on Saturday. She can take it on Saturday. Stacy can take it on Sunday, and then you can take it on Monday. So you'll have that choice. I don't see why that matters to have, might as well. It doesn't.
Oh, I was asking, like, if you're posting the quiz like before the lecture or after the lecture.
It's gonna open on before, so depending on what day I choose, either Thursdays or Saturdays, and then it's going to close every single time on Monday at 11:59. So it's already open. So right now, if this is next week, it's already open for you. So you can choose to take it like right when we get off on Mondays, or you can choose to take it at 10 p.m. or like someone did last night at 11:58, literally. So it will be open. So if you want to take over the weekend or after the lecture, then that's fine. So now that satisfies everybody's wish, other than me giving you the answer, which I can't. Well, I could do.
Ms. Amanda, I have a question regarding the syllabus.
Yes, Jenny.
Is a syllabus up for the new chapters?
The schedule is being made. It is, so I have it on another document, and there is a thing that says that it will be posted yesterday and today. And so, because you signed in just a couple minutes after I said that. So as of today, you will have assignments in there. So you will have at least half of it in there, and then the other half will be done by tomorrow.
Okay.
So I actually, once we get off, that's my next task is what I'm going to do. So that way you'll know, oh, the workbook, and oh, this is due and that's due. But if you do take a look right now, just to get an idea of what's coming, you can look in under assignments and you'll see you'll see the outline. You might not see the information, but you'll see the outline. Okay, so I just have to change the dates for the quizzes, and the not the syllabus, but the schedule will be up hopefully all of it today. I don't think I work tonight until 10, but I don't think I have to go until 5 because I don't think I have any admissions. Not that that's your issue, but if I do and go in early, then it'll be done by tomorrow night. If not, I'll have it done today. I didn't want to post too much because everyone seems so overwhelmed and you guys haven't even taken your test yet. I didn't want to throw too much at you, but I will put some stuff up. Schedule, good question. Test is due, it is Wednesday, correct? Can someone confirm that with me?
Yes.
Okay, perfect. What did I ask?
If the test due Wednesday.
Thank you. Like, wait, what did I just agree to? Okay, so your test is due on Wednesday. And it's not proctored. So just take it, turn it in. Your score will look different. I will go back in, I'll read your short answers. And as you notice, I do that very quickly so that you know what you got. Any other questions about anything? So next week we're having real lecture on Monday. It's going to be the real thing. I'm not pre-posting anything. I'll make an announcement about it. I'm going to post this video and it's going to be just like how Miss Carol's doing it basically. That way we're not doing, it's more effective for all of us. And thank you, student, who will remain anonymous. But I'm sure it was like half of you.
Hi, Miss Amanda. I have a question.
Yes, Miss Ellie.
To the test.
Yes.
Just on that is gonna work 50 points, but the questions is 30 questions.
37 questions, 50 points, because on the short answer questions, it's they're worth more because I'm asking more than one question. It's like, please explain this and why is it important? That would be 2 questions because you're explaining it and you're explaining why it's important. So that would be a 2.1. So that's why. So it's 37 questions and 50 points.
And how long you gonna how long you're gonna give us for the test?
How can you guys find that out? Oh, that's what I want to talk about, efficiency. So Miss Amanda is in my opinion very kind and it's real, like I'm actually kind and care. But what's some ways that we can look up certain things? For example, like if we wanted to know how much time do we have on the quiz, where do we look? Where would you guys look?
On the right side, on the top of your screen, it shows how much time you have left or how much time you spent on the exam.
Or how much time let's say you want to know, well, how much time am I going to have before I take the exam? Where would you go?
Quizzes.
So you would go under quiz and I write this quiz is this, and then underneath it'll say you have 75 minutes. So you would have 75 minutes. And not that that's not a bad question because maybe Canvas is Canvas, right? So we don't know all how to use it, but using our resources and trying, not that you shouldn't, basically try to find it out. So not what you're saying right now, Jelada, this is different. This is kind of a side note. Have me not be always the first immediate contact because everyone knows Miss Amanda has her phone on her all the time and I will respond right back. So just to help with my stress level and so that I can kind of be the best in my head and have a little bit better self-care so that I can better self-care for you. For example, if you didn't have your med sheet, let's say for clinical, you wouldn't email me, right? You would hopefully ask one of your classmates because your classmate's going to have it too. Gelada, that had nothing to do with what you asked, but it's good so that if you guys don't know, please, and I've never called you Gelada, you're Ellie.
Yeah.
So Ellie. So if you guys did not know where to find out how much time that you do have, please all you do, click on quiz and it'll tell you have 75 minutes, 37 questions, and it's worth 50 points.
Okay, thank you. I just follow, so
yeah, no problem. I'm sure that there's somebody else on here that may not have known that either. So that's a good question. And it's good to ask it here because then everybody hears it and it's going to be posted. So it's good. Okay, just reading to make sure that there's no other questions. Okay. Any other questions about anything relevant to like school? Anything about burns, the test? You guys said, yes, Luis.
I couldn't find for the study guide. It said to study frostbites.
Is
Is it like I couldn't find it?
Right.
Is it in the lecture or?
Yes.
Oh.
So if you guys watched my videos,
all right,
then you would know.
Okay.
Luis. Don't forget, I know where you work too. I know everybody. I know your boss. I know his boss. I know Pedro's boss. Yes, it's in the video, and it's basically it's so I can almost like predict what you guys are gonna ask. As I'm typing that, I could hear it, but it's not in the book. And even if you can't find it in the book, you can Google it, and it's there. I got the question from, I think that one was from Saunders or Kaplan, but it's yes, I do talk about it in my lecture. Good question. And the study guide, I hope once you see it and once you take your test that's helpful, that you'll see kind of like, let me know and we'll continue to do that. Cause I really like, as a student, I like study guides because you have this big chapter and you're like, well, what's she gonna ask? Oh my God, right?
Thank you for making that study guide for us.
You're very welcome. Thank you. I appreciate the appreciation. I'm really trying to make this the best situation that we can on Zoom. I hate this, by the way. So as much as you do, I want to see you. I want you in my face. I can think better when I'm moving and up, and your brain, like this is so hard for me, especially as you all know, I have ADHD, to like talk into a camera and I can't like get the energy of the room. It's very difficult for me. So I appreciate your patience with me getting adjusted to this type of teaching. It's very difficult. So thank you. Okay. So if there's no more questions, concerns, or anything, okay. That was weird. Not you guys, sorry. Something going on at the hospital. Okay, we're done. I'm not going to make this long and drawn out as I always do. I'm trying to improve that skill. So I hope you guys all do well on your test. Please note that in my opinion, you're going to see questions on there that you've, at least 10 of the questions that are on there you've seen before. So sit in peace with that, and you have a study guide. And the study guide is very on point. Exactly. And maybe even 12 of them you've seen before. And remember, look in your, that thing that you guys bought, that work thing, what's it called? The book, the workbook?
The workbook.
So even if it's not a question that has been assigned, I may still look at those questions and answers, because I may pick one of those. And I've said that in my orientation that you probably didn't watch, but make sure you're still looking at those too. I'm not saying like sit there and like memorize it, but take a look at it. So in the back of your mind, if you're taking your test, it's open book, you're at home, do what you want. You're not being proctored. You can go to the book and be like, oh yeah, that is it. and you're going to remember it. So please do that. You use your resources, because I've noticed on some of them, like one of them that you guys got wrong was a question in the back of the workbook, which, by the way, I take a long time to put the answers online that I don't have time to do, really, but I do. And like half of you still got it wrong. And I'm like, I almost called each and every one of you just because, but I did not. So please take that time, because I mean, 1 point is 1 point, right? You never know. That 1 point could be your difference between a C and a B and a B and an A, or a B and a whatever. Like in Miss, okay, my last thing, like in Miss Lynn's class, when I got an 89.4 and got a B, right? Maybe that 1 point that I could have got, I would have got an A. And that's my 1 B ever in nursing school. Obviously, I still have a grudge against it 14 years later. But so please, please, please use your resources. I'm not trying to make this hard. I'm trying to make this effective. Okay? I digress. Thank you for staying. Thank you for being here. Next Monday, real lecture. Thank you. Yay, we made it through. When I woke up, I was like, oh my God, I only slept for 2 hours. What's happening? So you guys, I hope you have a good week. Let me know if you need anything, and I will get your integumentary grades are going to be done like Wednesday, done, and we're moving on. Okay? All right. Have a beautiful day.
Thank you.
Thank you, Miss Amanda.
Thank you.
You're so welcome. Thank you.
Thank you, Miss Amanda.
Thank you, Miss Amanda.
Thank you.
Thank you.